This conference will now be recorded.
Sorry, we should again. Dr. Karen Rideout is a food systems and environmental health specialist whose work focuses on the social, cultural, and environmental influences on health. And using her experience in research and policy analysis, she creates practical, evidence-based tools and facilitates creativity and collaboration. Recently, Karen has introduced health equity considerations to environmental public health practice, developed public health guidelines for food donation, supported collaboration between the food security and food safety sectors, and contributes to evidence-based resources used by public health and local governments to create healthier built environments. Through her company, Karen Rideout Consulting, she facilitates cross-sector engagement with diverse professionals to create healthier built environments, healthier public policies, and healthier food systems. She has been an active contributor to the HBE Linkages Toolkit, and along with Tanis Cheadle as a co-researcher who has also worked with Karen on this report. So I'll pass this over to Karen, and her presentation should be up on your screen. Thanks, everyone.
Should I stand up?
If you like, yeah. Whatever you're comfortable. Oh, yeah.
Okay.
Just give me a nod or something.
Okay. So thank you. Anita, I apologize that I'm behind the camera, so I'll be a bit of a disembodied voice here. But so I'm really happy to be here today to talk about this new resource that has just been released yesterday, I think, or
yes,
this week. Mental health and well-being considerations for the built environment. And this is a new addition to the suite of tools that forms the Healthy Built Environment Linkages Toolkit. And it's now available on the BC website along with the Linkages Toolkit. And as Anita said, this was co-authored with Tanis Cheadle, who was also a member of this group and has been involved with the toolkit from its inception, really. So it was great to have a chance to work with Tanis on this, and also a really great working group that advised us throughout. So just, where's it not turning?
Trying.
There, keep talking. So just what I'm going to talk about today is just a very brief background about where this resource fits in with the broader kind of suite of healthy built environment resources that are out there. A little bit about our approach to how we assess the evidence and develop the planning solutions that emerged from that. And then I'm going to go through sort of the main sections of the report. And I'm not going to go into great detail about the evidence we found, but just go through some of the highlights and the kinds of planning solutions that have come out of that evidence. And you can read that in more detail in the report if you have it in front of you. And then we'll have some time for questions and just sum up. So as I said, so this is a companion to the Linkages Toolkit, and I'm guessing that most people, if not everyone on this line, is familiar with the Built Environment Linkages Toolkit. If you're not, just briefly, it is on the BCCDC website, and it really provides a framework for discussion around the links between health and the built environment, gives a quick reference to some planning solutions and principles that developers and planners can use to incorporate health considerations into their work, and then gives kind of a roadmap to the research that's out there that we're continually kind of building on it, and Sharita's been really active in keeping that going. And both of these resources are organized around these 5 core features. So healthy neighborhoods, healthy transportation networks, healthy natural environments, systems, and housing. And so that's kind of how we approach the work for this mental health piece that I'm going to be talking about today. In the most, can you just give us a quick?
Yeah.
In the most recent version from 2018 of the toolkit, when it was revised, there are 3 new sections called Considerations for Practice. There's one for social well-being, economic co-benefits, and small and medium-sized communities. And then there's also another separate companion document around health equity. And all of these really serve to both give another layer across all the different core features of the built environment to sort of lay on another lens related to these different topics. And they also give people an opportunity, if they're really particularly interested in focusing on one of these areas, to kind of dive a bit deeper and look at some more detailed evidence and ideas for how planning can support health in those different areas. And so the mental health piece is just the next step in that. So why did we decide on mental health as the next piece of this? Well, one thing is there's a lot of information in the existing toolkit that points to mental health related outcomes, but they're not really fleshed out in a lot of detail, so we wanted to look a little closer at the evidence around that. And then also in the social well-being considerations for practice P, there was a lot of information and evidence in that relates quite closely to mental health issues, so wanted to take that angle on it and go a bit further. And also kind of recognizing that, mental health is maybe newer in the world of health promotion and prevention, and wanted to take that opportunity to really focus on mental health and well-being promotion. And then at the same time, kind of recognizing that built environment initiatives and efforts can influence mental health in a positive or negative way, and so really wanted to be a bit proactive and look at where the research is so that we do have a positive impact and can avoid any unintentional negative consequences on mental health and well-being through this work as well. Just give it a quick thanks. There's also been some recent work coming out. It's still a very emerging area, but the 2017 Chief Public Health Officer's report from Teresa Tam that came out mentions mental wellness as an important consideration. A couple of years ago, a document from the National Collaborating Center for Environmental Health came out about an early review around green space and mental health, and green space is one of the key pieces that we address within the Linkages Toolkit, and that was actually written by Emily Rugel, who was one of the working group members for this piece. And then another piece that came out maybe the year before last, from the National Collaborating Centers for Public Health, so the collective of collaborating centers, focused on population mental health promotion for children and youth, and it also addressed a number of issues related to green space and social and physical environment. So I wanted to kind of build on that. And that report was actually co-authored by Diane Oikle, who was also on the working group for this project. And the next slide, please. So we really approached this document with a question, and we started out with asking, how can planning and design encourage, support, and promote mental health and well-being?
Yeah, my turn to go.
Oh, I think someone is not on mute. But if anyone's having trouble hearing me, if I'm too far from the mic, do speak up for sure. To answer that question, our sort of general approach was to start with the review of the evidence. So we did an evidence review of just review articles, so we didn't look at individual papers. So anything that came out within the last couple of years probably wouldn't be reflected in this yet. But that was really just for practical reasons to contain the amount of research that we were looking at. We also developed a grading system so that we could weight the research both by the quality of what was out there and the sort of level of evidence for different kinds of relationships. And we can talk more about that if anyone's interested in the nuts and bolts of how we did that. And we only included in this document information around relationships that were moderate to strong. So things that are really emerging newly from the research may not yet be reflected in here, but that doesn't mean that those relationships don't exist, of course. And all of this was then guided by input from our working group, which had representation from planning, developers, public health, and researchers. So they were really quite valuable in giving us some more context and making it hopefully more usable for folks. So the document is laid out, as I said, according to the 5 core features within the Linkages Toolkit. And there's an introductory section, and then for each of the 5 features, we have a summary of the evidence that we reviewed. And then we have some planning solutions that emerge from that evidence. And some of those are pulled directly from the original Linkages Toolkit, and we've indicated that, where those fit directly with the evidence around mental health. And then we also developed, for the most part, some new planning solutions or planning principles that are also evidence-informed. And then the other piece that's in there, you'll see if you flip through it, in most of the sections, I think there are icons that relate back to the different sections within the toolkit. So there's some for, the different 5 features, neighborhoods and transportation and things like that, and then also to the considerations for practice and health equity and other companion pieces. And this is just to provide an opportunity to cross-reference where we've touched on something where people might want to look a little closer at another area where things are quite relevant. And it's to give some context and balance to to the work, and recognizing that none of these pieces, we've looked at the 5 different areas, but none of it kind of happens in isolation, and anything you do in one area is going to have impacts potentially in another. And so just reminding people to check back and consider some of these interactions, and again, avoid these unintentional negative consequences if that's a possibility. Next slide, please. So I'm going to talk a little bit about how we defined mental health and well-being for this particular document. And we use the 2 terms, mental health and well-being, kind of in conjunction through a lot of it, and you'll hear me talk about mental health and well-being. They're a little bit distinct, and we went to adapted a model from Keys and Westerhoff, and so those of you who work in mental health will probably have seen some version of this, and we just adapted it a little bit purpose. And what this is, it's a bit faint if you can see it, but across the horizontal axis is kind of the mental well-being axis, and this is looking at, so we looked at research that talks about well-being versus kind of struggling or unhappiness. So this is health outcomes related to, really sort of happiness, sense of satisfaction with life, functioning in life, those kinds of things. And then the vertical axis looks at mental health versus mental illness, and this is really things like clinical diagnosis and symptoms, so major depressive disorders, depression symptoms, anxiety, psychoses, things like that. And what this model really just says is that these 2 things are not mutually exclusive, so you can have a diagnosis of a mental illness or clinically measured symptoms, but still be functioning at a very high or a low level, depending on a number of other circumstances. And I think that your environment, and social environments, and I think the environment can impact sort of where you fit in that quadrant. So that's kind of how we use to frame it. And if you can click again, please. We also looked at 3 other kind of categories of outcomes in the research. So social well-being, where it's specifically related to mental health. We looked at some research around mental restoration. This is really sort of feelings of tranquility and relaxation that comes from sense of mental well-being, and relates mostly to green space. And then cognitive, developmental, and behavioral outcomes. So this would be mostly relating to young children and older people, so outcomes related to dementia, ADHD symptoms, child development, and things like that. So in the next few slides, I'm going to go through each of those 5 sections and just give a highlight of some of the research that we came across in each of these 5 areas, and point you to the kinds of planning principles that have come out of that. But I'm not going to go through in great detail, but happy to answer questions about them at the end if people do. So I'll start with neighborhood design. Really, the research around neighborhood design was all about balance. So trying to find a balance between the need to have, dense and compact communities, but also affordability, safety, cleanliness, giving people enough green space and open space, and looking at the balance between those. So the research really focused around, mostly around density and land use and mix. So, not surprisingly, the research around density and mental health was a little bit mixed. So compact communities that have a lot of amenities and services can be very supportive of mental health and well-being, but crowding inner city communities afflicted by poverty and lack of upkeep associated with poorer and higher rates of mental health issues. So again, it's about balance and looking at the kind of density. We speak about that a little bit more detail in the resource. So context is really key, and context was also important between rural and urban when we're talking about density. Mental health tends to be a little more positive in rural areas, but rural areas that are undergoing population decline come with a higher risk of mental health issues. And then some of the more dense areas within rural areas also have better mental health. So it's really shows the importance of looking locally at what exactly is going on, and difficult to balance for sure. But the planning principles around that really focus, not that different from the original toolkit, around compact communities that have services and amenities, so not just density, but density with the other services that go along with it. And when there's revitalization or change in communities, that needs to be done slowly and with community involvement so that you're not pushing people out of communities as you change and work on improvements. Around land use and mix, the evidence really closely relates to the work that's in the social well-being piece within the toolkit. So things like diversity, walkability, and amenities, these services, again, also promote mental health and support mental health. And it's the kind of services, so really big retail developments that have big parking lots and are not pedestrian friendly, those have been associated with poorer mental health. So again, it's the way that things are done that seems to be really important. Another piece around land use mix was air pollution. So air pollution and noise, particularly that related to traffic, was associated with higher rates of poorer mental health and possibly related to cognitive decline as well from air pollution. So again, the planning pieces that come out of that are really looking at land use mix that gives opportunities for quality social interactions and then minimizing air and noise pollution, particularly near where people are living. Another bit of the evidence was around maintenance and security, and both perceived or measured sense of security. So places that are actually dangerous or where people don't feel safe are not supportive of good mental health and well-being. So the planning principles really focus on looking at how to design communities where you get that sense of safety and having eyes on the street and connected routes and good lighting and things like that. So transportation, I didn't go a lot into active transportation in this piece, but do recognize that there is a lot of research out there about active transportation, which of course promotes physical activity, which in turn has mental health and well-being benefits. But we didn't review that in great detail for this. There's not a ton of evidence related specifically to transportation and mental health, but what is out there focuses mostly around noise and congestion. So again, not surprisingly, traffic and airport noise in particular associated with stress and other mental health and well-being challenges. And they think that that's related to the chronic nature of that noise, so kind of that incessant nature of the noise seems to be more important for mental health in particular. And people's perception and the extent to which they're annoyed by that noise, again, not surprisingly, is also an important piece of that. So in terms of planning, it's around using sighting to minimize noise and then incorporating design elements, so whether that's natural elements such as trees or using building materials that block noise to keep some of that noise out there.
Sorry, Karen, I'm just going to shrink it for a second so I can get rid of that.
Sharia's computer really wants to reboot.
It really wants to reboot.
I'll keep talking while you're doing that. So around
Can I just ask a question? So the planning principles that you have come from those research papers that you looked at, or the working group?
Both. So we took the evidence that we found through the research, and then based on that, along with input from the working group. So congestion from commuter traffic is also a key thing to consider in transportation networks. Again, not surprisingly, contributes to stress and anxiety, particularly when it contributes to workplace tardiness, because of course being late for work is stressful. Not a lot out there in the research around specific types of transportation options, but emerging research around just having different options available for people so that people have choice in terms of how they get around. And then the diversity of options that includes public and active transportation also helps to reduce some of both the noise, the air pollution, and the congestion that can contribute to mental health issues. So natural environments definitely had the most research out there in terms of its relationship to mental health and well-being. And the basic message was that we need to have natural environments. People need to have regular and consistent exposure to nature. That was very clear coming through in the research. And there's a lot of different theories out there in terms of how and why natural environments contribute to positive mental health and well-being. And we just summarize them briefly in the document. Some of it is around that they provide opportunities for physical activity and social interactions, which then in turn have mental health and well-being benefits. There's opportunities for stress reduction, just from kind of getting away from it all in nature, that idea, being out in nature to kind of refresh your memory and improve your attention span. There's a theory called biophilia, which talks about a biological need that people have to interact with nature and other species. And then natural environments also play a role in reducing some of the other exposures like noise and air pollution that also can have outcomes. And so we didn't break things down in terms of the mechanism of how this happens, but just to sort of point out there's a lot of different theories out there. But there are also, the evidence really suggests that, particularly for things like, physical activity and social interaction, exposure to natural environments in green space has an effect on mental health beyond that you can explain by, people's extra physical activity or by the social interactions that they might be having. So if you go for a bike ride in the woods, you get physical benefits. Those have mental health benefits, but there's something beyond that is happening as well when you go for that bike ride in a natural or wilder space. So in terms of the research that's out there, just really briefly, it's important that those natural spaces are out there, even if people aren't interacting with them. So just the fact that they're there seems to have a positive impact on mental health and well-being. You don't have to go into it, which if you're actually interacting either physically, going out and hiking or being in those spaces, or engaging in some kind of social interaction in those spaces, that then also has other mental health and well-being benefits, as I said, that go beyond the benefits of just the exercise or what you might be doing there. Looking at natural scenes, just having a view out your window, for example, also has benefits in terms of, reducing stress, might be just related to the aesthetics and improving people's sense of neighborhood satisfaction, or just a sense of happiness that people get from seeing natural scenes. And then also there's research around the importance of having vegetation near the home, and this might be related to resilience, opportunities, again, for social interaction, and also some benefits around gardening and having close access to natural spaces. Again, similar planning solutions that come out of that, so really facilitating having green spaces and natural spaces and blue spaces, so water features as well, integrated throughout our communities in as many different places as possible and as close as possible to where people are. Having communal spaces that are accessible for all different types of activities, age groups, ability levels, so a real diverse range of things is important. And then having that mix of both wild spaces, trails and green spaces that are made for more active things, and also that have places in them for social interactions to happen out within nature, making sure you have windows that have views, and places close to where we live and work with. And then the next, food systems, there wasn't a lot of research specifically relating to food systems and mental health. This is quite emerging. But there is a little bit of research out there about community gardens and to some extent around food retail and food access. So community gardens are known to have mental health and well-being benefits, probably related to the social interactions that they encourage and facilitate. Also, a bit of research around stress reduction from gardening itself, whether that's community gardening or gardening in the home. So again, providing opportunities and the amenities that go along with that, so that you can facilitate the gardening process. So water sources, things like that. And also it's important that those garden spaces are both safe and accessible. So again, there's a bit of balance there to make sure that people feel safe in those spaces, but that they're not locked away too much and too private. In terms of food retail, there's a little bit of evidence coming out that having access to healthy, fresh food retail options is associated with improved mental health. I'm not sure yet why that is. There's some of it's around social interaction over food, sitting in a cafe and those kinds of things, but something about the type of food is also starting to show mental health benefits. And then there's also some research that, particularly for men, for some reason, that access to traditional indigenous foods and ways of getting that food, so hunting, access to the land, and methods of procuring and eating that food also has mental health and well-being benefits. So protecting and supporting those in planning is important. The next slide. And then housing is the last of the 5 areas that we looked at, and the research is really around mix and quality, and we focus on the external environment and building and infrastructure related to housing. Of course, indoor housing environments are also very important for health outcomes in general, and mental health would fit in with that. But we didn't look at that specifically just because we were keeping with the same scope of the Linkages Toolkit. However, some of the issues in terms of how housing is built does also affect the indoor environment. So particularly around, we looked at housing quality, a lot of things around how buildings are built will affect things like thermal comfort, dampness, drafts, mold, all of which actually are associated with risks for mental health and well-being. One of the interesting things in the research around housing was that there's been some research around neighborhood revitalization efforts of making improvements to the parks and active transportation routes and green space within a neighborhood in tandem with improvements to the housing stock have been shown to have improvements in people's mental health and well-being, particularly in lower income neighborhoods. For sure. Again, this is another area where balance and context is really important, because gentrification or rapid changes that don't involve the local community, that aren't maybe along what they're wanting, can make people feel less welcome. People can be pushed out financially, and so those, of course, are not what we're looking for mental health support. So that's an important piece. In terms of the planning principles for housing, really, not surprisingly, having that diversity of sizes, to have a diversity of family types and structures, age in place, and also a diversity of costs and features within the housing to meet different family and household structures. And again, that balance between density and affordability and other amenities and features such as space for green space and open space, and also personal space, while at the same time having opportunities for social interaction. So it's not an easy balance to strike, but important to think about. Energy efficiency, because thermal comfort and dampness, and particularly in a country like Canada, really do affect people's use of their home, which in turn can have mental health impacts as well. And there's some research out there around high-rise living, and particularly living on higher floors of high-rise buildings, particularly among lower-income residents, is associated with poorer mental health. So looking at balancing some of the pieces there. Not sure yet exactly why that is. It might be around also related to crowding and things like that, but also having a sense of personal space and sense of safety and security, and sort of control over your own little piece of the world, which is, of course, more difficult in a high-rise building. I think the next slide. So just to sum up, really want to stress the importance coming out of this that, this is sort of a layer that you can put over any of the pieces of the, when you're using the Built Environment Toolkit, and this just really stresses that importance of having a nuanced interpretation and looking at the ways that the different features and different interventions can interact. So, you can be doing something to support active transportation, and that's also maybe going to influence things like green space or different health outcomes than the ones you might be looking at. So just important to remember all the different pieces of that. So they're kind of mutually reinforcing. And again, to reiterate the importance of context and balance, because it's often a very fine balance, particularly around things like density and affordability, density and green space, and things like that. And that is it. I don't know if we're going to take questions now or after all the speakers. Now? Okay. And Sharita's here, who can also share if you have questions about where this fits within the, there's some other things going on in terms of developing of the Linkages Toolkit as well. And I do want to thank Tanis Cheadle, my co-author on this, who is fantastic to work with, and Sharito and Andrew for supporting this work, and the great working group that really, I think, added a lot to the process by adding that sort of real-life piece to the evidence that we're doing.